So talking today about a substantial amendment to our annual action plan pertaining to the city's allocation of 2019 CDBG-CV funds. As an overview, these are funds that were set aside and appropriated by Congress as part of the CARES Act to prepare, respond to, and prevent coronavirus. So these are funds that have been with the city since 2020, and which we need to spend by 2026, but we need to spend 80% of them by August 15th, 2023, which is why we're now doing a modest reallocation of funds to ensure we meet that timeliness deadline. That's a really high level overview, but let's go through the slides. So first of all, just CDA's mission, we've been charged, we serve as a clearinghouse for a variety of federal, state, and local funds for the city of St. Louis, including HUD funds, including ARPA dollars, and a smattering of other federal programs. We've been charged by Mayor Jones with leveraging these funds to drive economic justice, including economic empowerment of city residents and communities with investments in youth services, with investments in homeless services, with investments in people, in workforce development, and in entrepreneurship. We've also been charged with helping develop the city by investing in infrastructure and recreation centers, in digital equity, in federally qualified health centers, and in other infrastructure and community assets intended to ensure that every neighborhood and every community has access to the essential conditions for high quality of life. And then finally, to help transform the city by investing in neighborhoods, by investing in housing, combating vacancy, transforming our vacant land from a liability into an asset. So we're working to deploy these federal funds for maximum transformative impact in accordance with community input. And that's why citizen participation is a core part of CDA's process and what we're doing here today with respect to the CDBG-CV funds. Next slide. Here's just a quick overview of the range of agencies and programs which CDA funds. As you can see, it ranges from investments into youth to physical public improvements and economic development, from senior services and homeless services to fair housing and capacity building and beautification. And on top of all these agencies and programs that we fund, we also fund currently over 1,000 units of housing development, including 141 for-sale homes and over 1,000 rental units. Those are mostly LIHTC projects where CDA is just providing gap financing, but nonetheless, housing production is a big part of our mission as well. Let's move on to the next item. So here's just an overview of CDBG-CV funds, which is what we're really here to talk about today. Again, back in 2020, the city was awarded $13.2 million in CDBG-CV funds to prevent, prepare for, and respond to coronavirus. These were appropriated in ordinances number 71182 and 71241. The difference between those two is 71182 appropriated about $10.8 million for a very broad array of public services and public improvements. It gave CDA the authority to reprogram these funds within the CDBG-CV eligible uses. 71241 was more targeted. It came a little later after these CDBG-CV funds actually came in different tranches. And so 71241 was limited to appropriating the third tranche of CDBG-CV funds, 2.39 million, and it prioritized those funds and appropriated them for the purpose of rental assistance, which is what we are spending them on. The period of performance here is really important because it's what's driving us to reallocate these funds. 80% of the funds need to be spent by August 15th, 2023. 100% need to be spent by August 15th, 2026. And so what you'll see in the following slides is that while we're maintaining the majority of our appropriations, we are reprogramming a significant amount of funds previously set aside for housing production for other purposes that we can spend the money down more quickly. Because housing production, while it's much needed, unfortunately, is not does not move quickly, and we don't believe we can get this housing production money spent by August 15th, 2023. To be clear, while the funds need to be spent to prevent, prepare for, and respond to coronavirus, that is not sufficient. They also need to meet one of three national objectives: low to moderate income, slum and blight, and urgent need. And although urgent need was certainly an area that we were prioritizing early on, HUD more and more is kind of signaling to recipients across the country that given the end of the emergency, the federal emergency period, more and more they're going to ask recipients to meet the low to moderate income national objective. And then again, as I flagged before, there are citizen participation requirements that are actually reduced in the case of CDBG-CV funds relative to our regular requirements, because these were meant to respond to coronavirus and be sort of emergency response funds. They only require a 5-day public comment period, and we are in that public comment period now. Next slide. So here, this table essentially summarizes the obligations that we've made to date and which are not being touched. We're not reallocating these funds. These obligations are remaining in place. So just to go over them really quickly, they include $2.39 million to the Department of Human Services to provide rental assistance to residents at risk of eviction. It includes $2 million to Heat Up St. Louis for utility assistance. It includes $2 million for a public health campus in the bill managed by CARE STL. It includes $1.75 million for a variety of Department of Health programs, including youth programming across the city, antibody testing, and vaccination canvassing. And it includes awards to a variety of nonprofit partners: Mission St. Louis, St. Patrick's Center, Southside Early Child Care Center, Mary Ryder Home, Justine Peterson, Communities First, Guardian Angel, and Center for Hearing and Speech, to provide a variety, a wide range really, of services ranging from workforce development to childcare to other community services, and also in some cases including physical improvements to their facilities to ensure proper air filtration or HVAC or et cetera. There's also a CDA administrative line item, which we're drawing down from to administer these funds in full compliance. And there are $250,000 of housing production funds, which we are retaining and are not reprogramming, because we do think we can spend them within the period of performance. Next slide. So next, here are the $3.859 million which we are reprogramming and reallocating to new uses. And the first two are the big two items that account for $3.25 million of these funds, and they're both housing production program projects, and they're both wonderful housing projects that have received LIHTC awards and which we are still committed to funding. We are just going to transfer this commitment from CDBG-CV funds to other CDBG and potentially home, although likely CDBG funds, which are not time limited in the same way, because these are great projects that will add affordable housing. They both have received LIHTC awards, as I mentioned, and we're committed to supporting, even as we reprogram these CDBG-CV dollars. Next, we're reprogramming $255,000 in monoclonal antibody treatment. This is on the advice of the Department of Health and their partner who administered these funds, Affinia, and they let us know that while they spent down $245,000 of these funds, they would not be needing the remaining $255,000, in part because of recent guidance that antibody treatment is no longer the best practice in COVID treatment. We're also reprogramming $250,000 of our CDA admin funds because, frankly, we've spent down a very small fraction of them and don't believe that these additional funds are necessary, and we can reprogram them for more impactful purposes. And then finally, we're reprogramming about $104,000 in miscellaneous public services and improvements from Urban Strategies, Center for Hearing and Speech, Southside Early Childhood Center, and Gateway Homeless Services. Next item. Thank you. And then here is where we are reallocating these funds to. And I want to emphasize that these programs are all to public entities, you'll notice, and that's intentional in order to, we frankly don't have the time to go through a full competitive NOFA or RFP process, and therefore are allocating these funds to public entities that can spend down the funds in a timely fashion. The first item is a Department of Health outstanding payments to NOMI Healthcare for the provision of COVID-19 testing. This is a payment that has been outstanding for some time and that we are eager to pay for, seeing as it's really at the heart of what these funds are meant to pay for, COVID-19 testing and response to the pandemic. The second item is the purchase of a mobile vaccination and health clinic, again, right in line with the anticipated uses of these funds. I want to flag that on the next line down, there is an error. That dollar figure should be, if I can pull it up here in a moment, that dollar figure should be $175,000 for the purchase and installation of an air filtration unit at the Department of Health Animal Shelter. That should be $175,000. And then we're also allocating $100,000 to purchase masks for distribution at city recreation centers, as well as for other eligible purposes. And then we're allocating funds to both Slate and the St. Louis Community College for the purpose of expanding the pipeline of healthcare professionals, which we understand is a real constraint and limiting factor as we work to expand the city's capacity and our region's capacity to respond to a pandemic. We need to expand the pipeline for healthcare professionals. And these funds do just that by providing training vouchers and financial support for low to moderate income people, individuals to earn certifications to become certified nurse assistants or certified medication technicians, and also providing the community college with hospital beds and patient simulators to expand its nursing program. And then finally, we're adding another $1,127,000 to the Department of Human Services rental assistance pool to support low to moderate income city residents at risk of eviction. And that's it. Welcome any public comments or questions at this time. Do we have any members of the public present?
We have 3 attendees, and they appear to be some of our colleagues and city employees.
Wonderful.
And in the chat, we've asked if anyone would like to raise their comment, they can just raise their hand and we will put them on screen.
Yeah. Yeah, I think you're right. Unless they didn't give you information. No. I know you're not sitting on anything. That's you got it. All right.
If anyone would like to comment, we are ready to take questions and comments.
It is pretty straightforward though, so.
Great job, Noelle. You explained it all. Looks great.
I suppose so. All right, hearing no questions or comments at this time, I think we can close this public hearing.